Hi guys, I decided to make this video as a part of my education. I've been studying lately about tumor lysis syndrome and some of the ways that help people remember things and learn are, see one, do one, teach one kind of thing. So I've had my experience with tumor lysis syndrome just mostly through education. I haven't had a lot of hands-on experience with tumor lysis syndrome. Thank goodness most of my patients have done pretty well with their treatments as far as chemotherapy goes. So what tumor lysis syndrome is it's a condition that occurs in people who may have blood cancer or a large tumor burden, and their tumor cells are very specific to some of the chemo treatments that they're on. And so they may have a massive lysis of tumor cells or breakdown of the tumor cells. When those cells break down, they release the intracellular components. Some of the things that are released that cause some of the problems seen in tumor lysis syndrome are a release of potassium, which is higher in the intracellular spaces inside of the cells than it is outside of the cells, and also nucleotides from the DNA and RNA breakdown that are released from the cells, and also phosphates are released from the cells. When potassium is released from the cells, of course, it can cause some cardiac effects, such as VFib and different arrhythmias. Some of the things that we can do to mitigate some of the high potassium levels are give calcium gluconate and hydrate. Also, to try to improve the output of potassium through diuretics potentially. What we can do about the high phosphate levels, again, hydrate, of course exclude phosphate in the diet, but that works better for the long term if you have phosphate issues. And so improving excretion of the phosphates is helpful as well. Calcium is also going to be low in the blood because the extra phosphate is going to bind up some of the blood calcium, the serum calcium. So one of the problems we have when your blood calcium is low are going to be like prolonged QT intervals in regards to cardiac arrhythmias and some other signs of low calcium you may remember from accidental removal of the parathyroid gland. When you have thyroidectomies, are going to be things like tetany, tingling of the lips, numbness of the lips, Schwostek sign, which is like a tapping of the cheek like this. And you can see I have Schwostek sign because my calcium is currently low. So you can see my lips twitching towards the side that I tap. And I'll show Trousseau sign, which is something that we can elicit whenever we pump a blood pressure cuff up on somebody's arm, on their brachial artery, and we leave it pumped up to a pressure greater than the patient's systolic pressure for at least 3 minutes, and then you will see the hand kind of spasm inwards like this. So we don't, in tumor lysis syndrome, because the calcium binds with the phosphate and creates stones, and those stones can obstruct the flow of fluid in the kidneys and also become deposited in other parts of the body. We don't want to give more calcium to cause there more stones. So if we were going to treat the calcium, it would be more that we were giving calcium gluconate to help lower the potassium levels. Also, if you can remember, insulin and glucose administration help to push some of the potassium back into other cells, obviously not the cells that were lysed, the tumor lysis syndrome cells. And another issue that we have, which is related to what I already mentioned about the nucleic acids being broken down, is that they metabolize into xanthine, and xanthine then further is broken down into uric acid, which is later converted to urea and leaves the body. But we have this fast breakdown of the nucleic acids into the xanthine. So xanthine oxidase helps to convert or change the xanthine into uric acid more quickly. And uric acid, if you remember, precipitates out in the kidneys and can cause kidney damage because they're very sharp crystals. I don't know if you might remember gout. Gout also causes it's a uric acid excess issue that causes these crystals to deposit in your big toe or in your joints. It can be very painful, and typically we give allopurinol. Allopurinol is a xanthine oxidase inhibitor. So there is another oxidase inhibitor called, I want to say Fexabrate. I will have to look that one up. It's supposed to be better than allopurinol, but it slipped I just don't remember what it's called right now. Sorry. So those are xanthine oxidase inhibitors, which which slow the production of the uric acid, which is part of the problematic issue when it comes to the kidney damage from the uric acid. There is another drug that doesn't slow the production of uric acid, but it changes the uric acid into a form that is more soluble, and it's very effective but very expensive, and that's called rasburicase. So what else can we do? So we've talked about the high potassium, we've talked about the high phosphate level, we've talked about the high uric acid level, we've talked about the low calcium level that results from the high phosphate level, and we have talked about kidney damage. So some of the things that we could do to mitigate these issues are the drugs and the treatment, treating the electrolyte imbalances, hydrating the patient. If the patient has symptoms of TLS, but they don't have a diagnosis of TLS, then we can try to prevent that full severe form of TLS from occurring. And if they do have a diagnosis of TLS and they're requiring Q4 to Q6 lab draws for those electrolyte monitoring and whatnot, then they do need to be in ICU. So recognizing symptoms of TLS are going to be very important